Welcome to the presentation on Hernando County, Florida. The above referenced topics will be objectives this presentation will cover. Hernando County is located on the northwest side of Florida, approximately 1 hour from the Tampa International Airport. The climate is mild and attracts many snowbirds from northern states and abroad. The history of the county begins in 1840 when Fort DeSoto was established in what is now present-day Hernando County. The area was named after the Spanish explorer Hernando de Soto in 1844. Eventually, in 1845, the fort was established and became Percyville, now present-day Brooksville. The housing structures in the area are adequately built and maintained and affordable when compared to similar housing units in Pasco and Citrus counties. Homes are predominantly single-family block homes built in the 70s. Let's now discuss other structures in the community. Hernando has a wide array of places to worship. Many of the churches have community outreach programs. There are 2 modern libraries in the county. Hernando County also features various recreational facilities. For example, the Weeki Wachee Park is a state-owned park which features swimming and daily entertainment shows. One deficiency the author of this presentation noted was a lack of fine art exhibits in the community. The county population has grown by 1% from 2010 to 2013. A deficiency which may be noted is that the county does have a disproportionate amount of people older than 65 years of age when compared to overall Florida statistics. The local Chamber of Commerce reports that the community may have a 22% increase in population during the months January through May due to the influx of snowbirds. Seasonal populations increases emergency room wait times by up to 20 minutes, increases traffic commute times, and adds to vehicular accidents. When analyzing the data researched, it is evident that the community is predominantly white Caucasian with little racial diversity. The Caucasian population represents 78.1% of the county, while 22% represents Hispanic, Black, and Asian persons. The author of this presentation would also like to indicate there is only one ethnic food grocery store in the community. The data suggests that Hernando County has a much lower educational and income level when compared to the mean income and educational level for the state of Florida. Hernando County has adequate healthcare access, acceptability, and affordability programs. There are 2 main hospitals in the community, which are Oak Hill Hospital and Brooksville Regional Hospital. Access to the hospitals for those who do not drive is convenient. The bus has direct routes to both hospitals. The county has 5 walk-in clinics and numerous nursing home facilities which offer specialty services. The county also offers addiction and mental health counseling services. Many programs are free. The most prevalent causes of death in 2013 in order of occurrence were cancer, heart disease, chronic respiratory disease, stroke, and unintentional injury. Heart disease and stroke was chosen as a #1 objective for this community as cardiovascular disease is a leading cause of death in the community. It may further be noted that there is an abundance of fast food establishments in the community which may be attributed to the increase in heart disease and stroke. Tobacco was chosen second and represents the 3rd leading cause of death. In 2013, 47% of the community reported that either they currently smoked or did smoke within the last year. Environmental health was chosen 3rd due to the association of other types of chronic respiratory diseases found in the community. The Environmental Clean Air Program in the county is making a concerted effort to monitor air quality on a regular basis. Hernando County, Florida Air Quality Information Index 2014 report indicates that Hernando County scored a 93.79% in good air quality. This number represents a higher air quality rate than Pinellas, Pasco, or Hillsborough. Hernando County Public Water Supply draws public water from different well locations in the community. Strict routine water sampling at each well is performed on a monthly basis. The county does have adequate public transportation services for residents. Bike paths are safe and well lit in most places. The only airport in Brooksville offers daily commuter flight service, however, does not offer commercial airline service. This may be considered a deficiency in the community for business persons who travel frequently abroad. Commercial flights are available at Tampa International Airport, which is only 1 hour drive from the Brooksville area. The crime rate in Hernando County has been on a steady 5% decline since 2012. With the combined Brooksville Police Department and Sheriff's Office presence, the public has a sense of security in the community. Hernando County Emergency Management Services features a website for the public to access, which includes evacuation routes, emergency quick tips, emergency shelter locations, homeless shelter locations, emergency medical services, and animal shelter programs. The Brooksville Police Department is the primary law enforcement agency within the city limits and reports an average response time of 18 minutes in the rural parts of the county and 12 minutes in the city limits. The fire department response time was reported to be 8 minutes for 2014. The response time is a deficiency in the community. The deficiency is due partially to the condition of roads and outdated GPS data. The 2015 county agenda includes 7 road renovation projects which should facilitate police and fire response times. There are nuisance animals in the community, with coyotes being the most prominent. The county commissioners are voted into office by the public. The official duties for the position include providing a safe and healthy community environment and creating new strategies for growth. When speaking personally to County Commissioner Diane Rowden, it was evident community officials are very responsive to public inquiry, and there is little concern that public funds are used wastefully based on county official interviews and while attending county meetings. Hernando County, like most counties, features a wide array of fast food establishments. Because of the 24-hour convenience of these fast food restaurants, the county has had a high rate of cardiovascular disease and obesity. The county is deficient in health food stores, vegetarian restaurant options, and lacks fine dining restaurants. Hernando County does have a problem with meth labs in rural areas, according to the Sheriff's Office. The recent boarding of vacant foreclosed houses and buildings, along with a community policing program, has decreased the drug dealing hangouts and ease of purchasing drugs on the street. Tobacco usage continues to be a problem, especially with persons under 18 in the community. The author of this presentation chose the 6 overall health community needs in the specific order for the following reasons. Number 1, healthier eating established because fast food restaurants are increasing in numbers and cardiovascular disease represents the highest number of deaths. Number 2, tobacco education was chosen while statistics report a 47% use rate in the community. Number 3, diabetes is another concern and rates at number 5 for the most common cause of death in our community. Number 4, environmental protection is a concern with chronic respiratory disease rating number 3 as a leading cause of death in the community. And number 5, health screening. Many people can avoid malignant neoplasms by simply taking advantage of community-free screenings. And finally, the last health community need is the reduction of stress. The stressors of everyday life can be tolerable with time out with family and friends enjoying nature. The County Health Department reported that children who are considered obese rose 12% in the last year. From a global standpoint, efforts to reduce cooking saturated fats and limitations in superside food choices have proven to be an effective weight control option in countries such as France. The French magazine Le Monde Diplomate reports an effective response to combat the obesity epidemic, including cooking foods with more nutritional oil substitutes, reducing food portions, growing sustainable foods, and reducing the flashy packaging of carbonated drinks attractive to children. As a nurse in the Hernando community, with the abundance of farmlands and with active participation from the local agricultural extension office, farmers could receive incentives to grow crops and the public could be invited to purchase vegetables and fruits fresh daily from farmers. This would be cheaper than purchasing healthy food from big chain grocery stores and would support the local farm economy. Plus, packaging costs would be saved, which in turn would benefit our environment. While flashy packaging and the reduction of saturated fats may not be completely adopted by all school programs, the ideas France has employed to save their children from from heart disease is worth exploring. As a nurse in the community, healthier food purchasing options will encourage both healthier living and will allow for family time, which too will encourage overall better health. When one visits Hernando County, the strengths of the community are evident. Although there are a few shortcomings which can use improvement, the overall community is adequate and growing. It is the author's hope in this presentation that Hernando County was recognized through this presentation for its community involvement, new health promotion strategies, and peaceful nature allure. Thank you for your interest in viewing this PowerPoint. A complete list of references is attached separately for review.